Hi, this is Dr. Steve Pike, and today I'd like to talk with you about some alternative ways to prevent cavities. Traditionally, we have all heard about preventing cavities by brushing with a fluoride toothpaste and eating sugar less often. And those are very valid techniques, but oftentimes people find that I've been trying those techniques and it's still not working. I'm still getting cavities. So these are some other things that you can do that will help to lower your risk of getting cavities. The first way is to use baking soda. And there are several different ways to do this. You can make a mouthwash of baking soda. And if you want to do that, you'll get a glass of warm water and put in some baking soda until you can't dissolve any more of it in there. And then you'll rinse it in your mouth for 30 seconds. And you do that before bed and spit it out. Don't rinse with clean water, and then go to sleep. It's safe for both children and adults, but I'm only really speaking towards children here. If you're an adult and you're in a medically complicated situation, you should probably talk with your primary care physician first. Well, you'll just make a super saturated solution. So you'll get a half cup of warm water, and then you'll just keep adding baking soda until you can't add any more. If you don't want to do that, you can put a little bit of the toothpaste that you like to use, put that on your toothbrush, and then you can dip your toothbrush in some baking soda, and then just brush your teeth like that. And that'll work great too. So there's a lot of different ways that you can use this, and they'll all work just fine. Well, you can do it as a paste or liquid. Either way is fine. Just get the baking soda on the mouth. It'll raise the pH of the mouth and encourage the growth of the good bacteria and discourage the growth of the bad bacteria. The second way to prevent cavities is to use a product that has arginine in it. And arginine is an amino acid which is naturally found in the body, and they're starting to add this as an ingredient to some toothpastes. Now, these toothpastes are being sold for relief of sensitivity, but they work great for preventing cavities. The way that arginine works is that it raises the pH in the mouth. When you raise the pH in the mouth, it promotes the growth of good bacteria, and it makes it an inhospitable environment for the bacteria that like to cause cavities. So you get more of the good guys, less of the bad guys. There are a few commercial products out there that have arginine. Some are available prescription only, which we sell here at the office. There is also a Tom's of Maine sensitivity relief product that does contain arginine and xylitol, which we'll talk about next. Xylitol is a natural sugar which comes from birch trees. It was discovered in Finland, and they've found that people that use xylitol get fewer cavities. The way it works is that the bacteria that cause cavities, the Streptococcus mutans, do not like to digest the xylitol. So we get less strep mutans with people that have 6 grams of xylitol per day. This is the difficult thing about xylitol. It has a threshold dose. So you need to have 3 servings of xylitol spread out throughout the day in order for it to be effective. If you don't see that threshold, you really don't get much of a decrease in cavities. It doesn't cause any harm, but we don't get the same benefit. Xylitol is an over-the-counter medication. It's put in chewing gums, it's put in toothpaste, it's in all kinds of products. It's also in a powdered form or crystal form, and you can go online and you can find all kinds of products. The people that use xylitol well, they often buy this in bulk. They'll go to Amazon or wherever and buy 1,000 pieces of xylitol gum, and then after every meal they'll have 2 pieces of gum. In these people, that will not only get rid of the bad bacteria, but it will also increase the flow of saliva, which also has a preventive effect. All 3 of these products are similar in that they all promote the growth of good bacteria in the mouth. Good bacteria don't cause cavities. If you have any questions about these products or you'd like to discuss some other products, please give us a call and come on in. We'd love to talk with you about this. Thanks.